All infants cry, but a certain percentage, about 25 to 30% of infants, have episodes several times a week of inconsolable crying. I'm Dr. Linda Slack.
And I'm Dr. Kelly Began, and we're going to be talking about infantile colic. So, what is colic? As Dr. Linda just said, it's when an infant is inconsolable, they cry excessively for no reason that you can truly identify. You've just changed their diaper, you've given them a bottle, you've tried to settle them down, nothing is soothing them. And colic follows a very similar pattern of what we call the rules of three. So, what are the rules of three? The rules of three are when your infant is crying excessively for 3 or more hours each day, for 3 or more times each week, and for 3 or more weeks. So if your infant is following,
It's also usually for in the first 3 months of life.
yes. And a lot of people hear from their doctors that colic typically starts early in life, but then typically they grow out of it within 3 to 6 months, which is hard for a parent to hear, especially when they have that infant that is inconsolably crying. Because that's not only a stress on the baby, but it's a severe stress on the family. As we know, we see this in practice quite frequently. And you can just see the parents and the moms coming in and they're drained. Like it's hard hearing that there's nothing that you can really do because you don't know what's causing it. So talking about the cause of colic, research and scientists have different perspectives as to what causes it. Nobody really knows. They say it's an immature nervous system. They say it's an immature digestive tract. But there's nobody really knows why infants have colic. It could be that they have a headache. It could be that they have musculoskeletal pain, but they don't know how to communicate that with you other than through crying. So again, it's super hard for parents to hear that because they don't know how to help because they don't know why it's happening. But going off of that, we see this a lot in practice. So Dr. Linda, what do you have to say about infants with colic in practice?
Yeah, so chiropractors have had great success with infants and colic, and the reason being is that about 30 to 50% of them are the colic. Most parents think that when they hear the word colic that it's a digestive issue. So the first thing to rule out when they go to the pediatrician is to look and see if it is a milk protein intolerance, and that would be taken care of by either having the mom who's breastfeeding discontinue all dairy products or stop or to switch to a very highly sensitive formula. And the amount of time that it takes about 1 week for it to get out of the system of the infant and of the mom. So if we do that and we still have no relief of symptoms, we know that it's probably not digestive, that it's something else. And so in our history, when we see an infant, we're going to look to see, for example, if they had a traumatic birth. That could be one cause. Was the infant, were they in constraint? Did they have in utero constraint while in the womb? Where the parent will say, yeah, on every ultrasound, the baby was stuck in one area, or their arm was up over their head.
Or they were sideways.
Right. Something of that nature that caused it. And we see infants with all different types of colic. Usually the colic episodes happen in the evening, by the way, in late afternoon and evening, and they continue for that 3-hour period, which drives the whole family crazy. So when parents come in, they're like hair standing on end, right?
Exhausted.
They're so stressed out, and that stress proliferates because the baby feels the parent's stress, and that makes it even worse. So let's talk about two cases that we have in practice right now, where I remember when one of them, the first one we're going to talk about, when the mom and dad came in, the dad was sitting in the chair and he said, when my wife leaves and I have to take care of the infant, she just screams the whole entire time. She won't take a bottle. I can't console her. I do everything I can.
Yeah.
Nothing consoles her. And the dad was like, I don't know what to do.
Yeah. And then he feels bad about it because he feels like he can't do anything.
Exactly. And then I said, don't worry. We're going to have a brand new baby in a couple of weeks. And sure enough, after a few visits, she started to relax and we unwound the system, and she was a new baby.
She was a
And
completely different baby.
no longer screaming, consolable when she did, becoming a more normal infant. What happened to the second one? The second one was a very extreme case of colic. I remember in the beginning that every time I picked her up, she spit up all over the room. Remember
Oh
that?
my gosh, projectile.
So, and screamed, not just at night. This infant screamed 24/7. She was in such distress. And that infant is still not 100%, but and it's been about 4 to 6 weeks that she's been under our care. Tremendous change. The
Yeah,
parents
she
come
said
in and they're
leaps and
so
bounds.
relieved and happy, right?
Yeah. Each baby's different. Each baby presents differently. And as an adult too, it takes time for certain things to heal. And similar with infants, if you don't know what's causing it, sometimes it can be a long time for them to seek full relief and full remission from that excessive crying and
Right.
discomfort.
And the important thing here is parents, every day is like a month in a life of an infant, and they want instant results. So they're looking for that quick fix, and it all doesn't always happen that way. So we have to make sure that they know that this could take some time.
Yeah, because every
Just stick
baby is
with it.
different and you never know. But talking about what or how it affects the family, but how does it affect the child in the long term? With infants with colic, they over time when they get into toddlerhood, they might miss milestones. They might not have proper development. I think we should talk about that.
Yeah. So in the very first year of life, so much happens in development, in the trajectory of brain development, when the infant's just lying there and totally completely dependent on their parents, to when they begin to start to roll over, sit up, and eventually stand in that first year. There is a lot of neurodevelopment, brain development happening. And if you have an infant who's screaming through that process, they are likely to skip some of those developmental milestones. And then that's going to affect them later on down the road. When they get into toddlerhood, that colicky baby is going to turn into an irritable, tantruming toddler.
Yeah, just as inconsolable sometimes.
Yes, they have their moments more so than others.
Yeah. And I know that a lot of parents that come in with babies who are now into their toddlerhood, like just the other day, we had a parent come in and say, why, like, is this normal for my daughter to be having like this many crying fits? It's over something so minuscule. And yes, is that just toddlerhood? People ask, oh, is that just my toddler being a toddler, or is this something more? And at that point, we always say, why don't you just bring them in so we can check it out? Because better be have them come in so you can have a better day without having to fuss with your toddler all the time.
Exactly.
Yeah.
So what else do you got?
Um, um, so we already talked about the treatment options and that type of stuff. I don't think we have anything else.
All right. So there is a lot of research on this topic. We will post a link to that research if you're interested in getting further information. But the most important thing is you don't have to know that you don't have to suffer when you have an infant undergoing this situation. If they're colicky, there's an answer. And chiropractic is safe, effective, and should be the first line of defense in taking care of an infant with colic.
Exactly. So we have a link down below for our website for where you can get those resources, and stay tuned for next week for our next topic on constipation.
Very good. Until next time.